So can anyone identify who are these two? These two are nothing but Munna Bhai and Circuit. Okay. So Bollywood has Munna Bhai and Circuit. But what does anesthesia have? Anesthesia has machine and circuit. Okay. So M for Munna Bhai, M for machine. So for us in anesthesia movie, we have, instead of Munna Bhai and circuit, we have machine and circuit. Okay. So now we are going to discuss machine, circuit, and the simple kind of questions that are asked about it. We are not going to go too much into detail, only the questions that are asked about it. So now this is the anesthesia machine, as all of you can see. And what is this that you can see here mounted on the top of the machine? Yes, these two things that you can see, these two dabbas, they are called as vaporizers. They are called as vaporizers. Okay. What does a vaporizer do? Basically, the vaporizer will have liquid anesthetic agent in it, and it will convert this liquid anesthetic agent into vapors. Okay. So vaporizers actually convert the liquid anesthetic agent into vapors. Now you will say, ma'am, what is the question that will be asked in the exam? So the question that will be asked in the exam is to identify what is the inhaled anesthetic agent in the vaporizer. We will discuss that ahead when we discuss inhalational agents. The next thing you need to identify in the machine is this glass tubes over here. So these glass tubes are nothing but flow meters. Flow meters. And one more thing you need to identify here, you will have a dabba of carbon dioxide absorber. So they will ask you in the exam, what is the most common carbon dioxide absorber used? And this you should know. The most common carbon dioxide absorber that we use is called as soda lime. Second question that comes about a carbon dioxide absorber is, what is the main component of carbon dioxide absorber? So the main component of carbon dioxide absorber is calcium hydroxide. Okay, many of you all will see soda lime and you will answer it as sodium hydroxide, but no, the main component of carbon dioxide absorber is calcium hydroxide. Okay, so these are the important things that you need to know about the machine. From the front, you should be able to identify the vaporizer, the flow meter, and the carbon dioxide absorber. The back of the machine, we will have cylinders. We will discuss about the cylinders and the pipelines and their color coding ahead. Okay. Now, what are these? These are the three types of circuits that you should know for the exam. The first one is, as you can see below, this is the open method of anesthesia. What they used to do is just keep the mask on the patient's face, put one handkerchief, one rumal full of chloroform, and keep dropping little chloroform on top. Okay. So this is the open method of anesthesia. In this, the patient was breathing from the environment and he was exhaling into the environment. He was breathing in and breathing out, all into the environment. So this was the open method of anesthesia. Okay. It is almost like kidnapping someone when you hold that napkin and you kidnap them with chloroform. Now, the next thing that you can see, after this open method, they said, no, we don't want to be kidnapper. Let us be little hi-fi kidnapper. Okay. So hi-fi kidnapper was this, the Mapleson systems. These are also called as semi-closed systems or Mapleson systems. Now I see so many of you students pura dimag kharab karke rakhte about Mapleson. You all will be like, ma'am, we did this mnemonic, that mnemonic, Mapleson A, B, C, D, E, F. Entire thing में Mapleson A, D, E, F नहीं, Mapleson के नाम पे B, C हो जाता है. Okay. So what are we going to do? We are going to discuss about what are the important Mapleson questions that come in the exam. There are only 3 questions that will come about Mapleson system. Only 3 questions. The first question is Mapleson system of choice in pediatrics. Okay, I'm writing this over here. Mapleson system of choice as MSOC. Mapleson system of choice in pediatrics is Mapleson F. Mapleson F. Okay. The next question, or this can also be called as Jackson-Rees circuit. The next question they will ask is in adults for spontaneous ventilation and in adults for controlled ventilation. Okay. So in adults for spontaneous ventilation, the Mapleson system of choice will be Mapleson A. And in adults, for controlled ventilation, the Mapleson system of choice will be Mapleson D or Bain's circuit. Okay. So this is all that will be asked in the exam. Only 3 questions about Mapleson and nothing else. If they ask you to identify any Mapleson circuit, remember there are only 2 Mapleson circuit that we use now. I will show you the picture of those 2 Mapleson circuit. So if you see tube within a tube, can you see there is a green tube within a tube, green tube within a white tube. So this is Mapleson D. Mapleson D. Again, you can remember this as D for double tube. So you can see 2 tubes. One is green inside and the other one is white outside. So this is Mapleson D or Bain's circuit. Bain's circuit. Okay. And the next one that you can see over here, it looks very short. It's very short. The bag is very small and there is a green tube outside which is coming. So this one is nothing but Mapleson F, or it is also called as Jackson-Reef circuit. Jackson-Reef circuit. I remember it as Jackson-Reef circuit. Why Reef? Then it is easy for me to remember F and F. Jackson-Reef or Mapleson F. Okay. So this is what 2 systems that are in use in anesthesia, and these are the only image-based questions about Mapleson that can be asked in the exam. Otherwise, repeatedly every year they ask us about these 3 questions. Mapleson circuit of choice in pediatrics, Mapleson F. Mapleson circuit of choice for spontaneous ventilation in adults, Mapleson A. Mapleson circuit of choice for spontaneous ventilation, for controlled ventilation in adults is Mapleson D. Bas, khatam, story over. Okay, बस इतना ही याद रखना है.